You are watching the DocTalk show.
Welcome back. With me is a senior consultant urologist, Dr. Mohan, who is taking us into the discussion of prostate cancer. We're here to understand what exactly causes prostate cancer, how it can be managed, and how it can be prevented. So, Dr. Mohan, in your experience, which people seem to be prone at getting prostate cancer? Are there any risk factors?
The African and the Afro-American are at the highest risk. That's because of the race. Race is a critical factor in cancer prostate. That's because the African male has the highest testosterone. The normal range is 100 to 900. Most Africans are more than 700, as compared to the Caucasians who are 500, as compared to the Indians or the Chinese who are around 250. So the mere presence of higher testosterone, which is the food for the cancer cell, puts the African male at risk, maximally.
So by race, you're saying that because you have very high testosterone levels,
there's a higher possibility of
very
cancer
high
prostate.
risk.
Yes.
Okay. And also because we're dealing with the prostate, which is an organ only in males, it doesn't occur in females.
It doesn't occur.
Also being a male makes you
Yes.
at risk for prostate.
Absolutely.
for prostate
Absolutely.
cancer. Is there any other risk factor that would predispose?
Besides these two risk factors, there is a familial pattern to cancer prostate. As I said, alluded to earlier, if there's another male member of the family, uncle, father, brother, that
Or
puts
the
you
grandparents or the parents?
any male member
Any male member.
who is related to you, who has had diagnosed cancer prostate, there's a 30 times higher risk of you developing it.
And that is linked to the genes that you're trying to
The unhappy
talk
genes that
about,
have
the
been
unhappy
transmitted
genes.
vertically through the family.
Okay. And you also mentioned age being a risk factor, that it increases with age?
Yes. The longer you live, greater is the possibility of cancer prostate, irrespective of race.
And I think that is, could that be related to like too much exposure to the hormone, testosterone?
It could most probably be explained to the cell getting aged in the prostate, because unlike the female, we do not have a distinct andropause. And the prostate, andropause means like menopause. In the lady, at some point, the hormonal drive stops. In the male, till your last breath, the hormonal drive stays. The intensity may reduce, but the testosterone hormonal drive on the internal male genitalia remains.
Are there some signs or symptoms? it can
Unfortunately,
present
there are no signs and symptoms. The only way to pick up prostate cancer early so that it can be effectively cured is to look for it.
with? To look
And
for it. So
yes.
it seems to be a quiet disease.
Yes, it's a very quiet, surreptitious disease waiting in the shadows. So, age greater than 45, a yearly test of serum PSA, a blood test, is a useful tool. In those with a familial history, possibly starting an annual PSA measurement beyond the age of 40 is a pragmatic step to take.
Okay, as a way of preventing.
As a way of preventing or
Because
picking
the-
up early.
Because the early disease will have no symptoms. The person will be as normal
Absolutely.
as-
Only late disease has symptoms, and by the time you diagnose, there is no opportunity to cure the disease.
So what are the symptoms of late disease?
The symptoms of late disease typically are bone pains, back pain, low back pain, classically. There is a sense of lack of well-being with weight loss. There may be blood in the urine or difficulty in passing urine. Bone pains is the dominant low backache in an elderly gentleman who was otherwise healthy, is the dominant symptom that should ring a bell. Could this be cancer prostate?
Above the age of 45, all men should have.
A yearly serum PSA.
The PSA is
It's a blood test. If the value is below 4, it indicates an age-related enlargement of the prostate. If the value is between 4 and 10, it needs further thought process to be put in to find out what is happening. If it is beyond 10, after a course of antibiotics for 2 weeks, it stays more than 10, then a biopsy to rule out cancer prostate becomes inevitable. So 4 is the magic number. Below 4, safe zone. Above 4 needs to be investigated.
And it's a relatively easy test to do.
Easy test to do.
Just a blood test.
It's just a blood test. The report can come back as early as 30 minutes. It's available across Africa. In Uganda, it must be available in at least 150 centers. It is cheap. It's efficient, and it is available as a good screening tool.
It's a very good screening tool. So we recommend every man who is above 45 years to get a PSA.
Done annually.
To be done every year?
Every year.
Okay. So are there other tests that can be done to investigate for this prostate cancer apart from the PSA?
So as I said, if the PSA is more than 10, then you give a 2-week course of antibiotics to see the trend of the PSA. You repeat the PSA, and if let us say it's 11 or it stays 10, then ultrasound guided biopsy of the prostate is necessary. A needle will be put through the rectum, the passage where shit is sent out, stool is sent out, and a needle with ultrasound guidance is put, and various areas of the prostate, 8 samples are taken which are 1 millimeter thick. Thin,
so they're very
coarse, small bits
tissues
can be done
samples.
on an outpatient basis.
Okay.
Not painful.
Not painful at all.
Not painful
most
at
people
all.
when they hear needles, they now start.
No. Local anesthetic, a painkiller can easily allow an elderly gentleman to undergo a ultrasound guided prostatic biopsy. And this biopsy course, 8 course is what is taken, octa-core, 8 course. 8 samples from various areas of the prostate is then sent to the pathologist, who will report on whether there is cancer or not.
Okay.
So the next step to a raised PSA, which has not come down despite treating with antibiotics, would be a ultrasound guided biopsy.
Ultrasound guided, and that will tell us if indeed
there is cancer or not.
All right. So if they find there is the cancer, what else do they do?
The most important point when they find cancer is to grade it. It could be mild, moderate, or severe. It is called Gleason score. If it is 0 to 3, we call it mild. If it is 4 to 7, we call it intermediate or moderate. And if it is 8 to 10, it is severe or high.
So this Gleason score,
the pathologist will provide. Is there cancer prostate? If yes, what is the score of this cancer?
More like what is the severity?
Yes.
How severe?
If it is mild score, then it makes cancer prostate very gentle. If it is high score, it makes it very aggressive. 1/2 of the cancers are intermediate, a quarter are high, a quarter are mild.
So this mild, moderate, severe prostate cancer, what would it mean? Would it like dictate treatment in any way?
It will dictate treatment and the prognosis even when treatment is taken. If it is mild and it's an elderly gentleman, say age 80, not doing anything is an option. He will die with the cancer, not of the cancer. Or doing the least required.
Just waiting, taking a waiting approach.
Suspended animation, wait and watch, expectant approach.
Because it is the mild form, it's
and
not.
he's already 80. So you only do definitive treatment of cancer prostate if there is at least 10 years of good quality life expectancy, what we call as the Karnofsky score. So the gentleman must have at least 10 years ahead of him if you want to aggressively pursue cancer prostate. So if it is mild score and the patient or the gentleman is already aged 75 or 80, watchful expectancy becomes a possible treatment modality. If it is intermediate, here definitive treatment is more often than not the right way to go. And a single modality will work. Yes.
You have to do something, an intervention.
Intervention, and single modality may be useful to cure the disease.
Single meaning like of all the treatment options, you can pick one.
One, and that alone should suffice
to
cure the disease.
So if it is severe, what
then multimodality treatment.
We need multiple treatments.
Multiple treatments, or together or at different points in time to help the patient recover completely.
Okay. So the term severe makes it sound like it's difficult to treat.
Basically implies it's a quick multiplying cancer cell, and it has taken more than one route to go out of the prostate into the rest of the human body. Blood, lymphatics in contiguity. You go
That
from
is, direct
direct
invasion
invasion
tissues.
is all possible in high grade. So whereas in intermediate grade, they possibly have chosen only one route. So it's easy to mitigate, control.
Okay. All right. So we've looked at doing the blood test, getting the biopsy, of which the pathologist would stage it, grading according to the Gleason score. If it is a severe disease, what else can the doctor do?
The next important thing is to stage the disease. Stage. Is it organ confined? Is it only in the prostate? Or already at diagnosis it has escaped elsewhere? So the way to do it is either to do an MRI scan, or if available, to do a PET CT scan. A PET CT scan at this point in time is unavailable in Uganda, but a high quality MRI is available. This will then tell us, is the cancer confined to the prostate or has it gone elsewhere?
Okay, because that also has treatment implications.
Absolutely. Only in organ confined cancer prostate we can do definitive curative treatment, what is called as intent to cure. If it has gone beyond the prostate, we cannot cure, so our treatment will be with intent to control. Okay. So there is an intent to cure and there is an intent to control. So the staging investigation will help us to decide what is our intention, and then we take it forward.
Okay. We're still discussing prostate cancer. I am with the senior urologist, Dr. Mohan. After the break, we shall look at the treatment options that are available for controlling this cancer and what can be done if there are any methods that can be done to prevent this cancer. Remember to send in your questions on our social media platforms on Facebook and Twitter, and our doctors will respond to them.
You are watching the DocTalk Show.